Have you been diagnosed to have disc prolapse in your lower back? And are you worried about what to do next? Well, my name is Dr. Umesh Srikantha, presently working as a consultant and head of spine services at Asta Hospitals, Bangalore. In this video, I am going to give a short summary of what to do after being diagnosed to have a lumbar disc prolapse. If you really want to know the basics about disc prolapse, or you want to know right away the surgical options, watch one of our other videos, the link to which is displayed on the screen. Well, many people think that having a disc prolapse will ultimately end up in surgery. To state the facts, of course, only 3 to 5% of the patients diagnosed with a lumbar disc prolapse will ever need a surgery for it. Most of the disc prolapse get better with conservative treatment itself. So what are these conservative measures? Conservative measures can be started if you have only back pain or a leg pain without any significant numbness or weakness in the leg. If you have numbness or weakness, please note it is better you consult a spine specialist before starting conservative measures by yourself. Well, in fact, majority of the low back pain get better with home-based therapies. Over-the-counter pain medications can help you reduce or control the pain in its acute stage. Of course, they should be used very regulated, should not be used very frequently. Cold packs, which cause acute numbness in the area, constrict the blood vessels and reduce inflammation from becoming worse, are very, very useful in controlling the pain, especially acute pain. Or hot pack, which were more useful in the recovery phase, wherein they increase the blood supply to the area and relax the muscles or the joints. So both of these can be tried at home. A limited period of bed rest, of course, only for a few days, maybe 2 or 3 days, can probably help in getting faster relief from the pain, but prolonged bed rest, mind you, is not recommended. Light stretches, preferably under the supervision of a physiotherapist, can also help to get back to your routine faster. But what do you do if these measures don't work? So with the previously mentioned measures, if your pain doesn't reduce by more than 50 to 70% in around 7 to 10 days time, or if you start developing any additional symptoms like numbness or weakness, it is always better to see a spine specialist again. There are a few options that are available at this stage. Either you may continue with conservative measures, because in some cases it may take longer than usual to respond, or you may opt for an epidural injection if your doctor thinks that it's valid for your case and advises you to take it. An epidural injection is basically nothing but a numbing injection, that is a painkiller that is also mixed with a steroid in many cases, that is given directly to a safe area around the nerve root to cause a numbing effect on the nerve. And the steroid acts to reduce the inflammation and thus aid in the faster healing of the disc prolapse if it is small. The procedure is done by passing a thin needle under local anesthesia to the desired area. The idea behind giving an epidural injection is to make the patient pain-free, or at least reduce the pain significantly, so that the patient can go about his routine activities and doesn't have to suffer from the pain throughout the time that the disc prolapse takes to heal by itself, and also to reduce the intake of pain medications, which also have side effects of their own when taken for long periods. Of course, epidural injections many times have temporary effect, and in some cases the pain may recur once the effect of the epidural injection wears off. More importantly, there are some serious signs which should not be neglected, and a doctor visit should be done as soon as possible. These situations are if there is a worsening of the electrical or shooting pain in your leg progressively, there is progressive weakness or numbness in the leg, which could probably suggest progression of the nerve damage and the nerve becoming more and more weaker, difficulty in passing urine stools, or urinary incontinence, inability to control your urine, which is probably a very ominous sign, and that suggests severe nerve damage, and immediately something needs to be done in these cases. So these are considered like red flags, where many times surgical intervention needs to be considered, the decision of which will be taken after reevaluating your progress and clinical examination and comparing it with the baseline if it's available for us. Of course, surgery will almost always be required, as I mentioned, when there are cases with urinary disturbances or multiple nerves are severely affected, in which case it has to be done sometimes as an emergency procedure also. So this is about the initial management of disc prolapse. To know more about the types of surgery that are available for the disc prolapse, please watch our next video in the series, the link for which is displayed on the screen. And to get subscription for more such videos, follow our YouTube page, that is Spine 360. Thank you.